In this video by Deckplate, we will understand the VA disability ratings for thyroid and parathyroid conditions, hyperthyroidism, including but not limited to Graves' disease, hypothyroidism without myxedema, C-cell hyperplasia of the thyroid. Disclaimer. This video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. The VA disability ratings for thyroid conditions are based on the severity of symptoms and any associated complications that affect other body systems. These conditions, which include hyperthyroidism, hypothyroidism, and C-cell hyperplasia, can have a range of effects on physical and mental health, and ratings vary depending on symptom severity and duration. Diagnostic code 7900. Hyperthyroidism, including but not limited to Graves' disease. Hyperthyroidism, such as Graves' disease, occurs when the thyroid is overactive, leading to symptoms like weight loss, anxiety, and increased heart rate. For 6 months following the initial diagnosis, a 30% rating is assigned. After this period, any residual symptoms or complications from treatment are evaluated under the appropriate body system diagnostic codes. Note: if hyperthyroid cardiovascular or cardiac disease is present, separately evaluate under diagnostic code 7008. Hyperthyroid heart disease, eye involvement, common in Graves' disease, may be separately evaluated for conditions like diplopia, diagnostic code 6090, or visual acuity impairment, diagnostic codes 60, 61 to 60, 66, based on the most appropriate diagnostic codes in section 4.79. Diagnostic code 7903. Hypothyroidism, which results from an underactive thyroid, can cause symptoms like fatigue, cold intolerance, and mental sluggishness. Ratings for hypothyroidism vary based on the presence of myxedema, a severe form of the disease with symptoms including muscular weakness, cardiovascular involvement, and mental disturbance. Myxedema, rated at 100%, this rating remains for 6 months after stabilization by a physician. After 6 months, any residual symptoms are rated under the appropriate body system diagnostic codes. Without myxedema, rated at 30% for the first 6 months following diagnosis. Afterward, any remaining symptoms are evaluated under relevant body system codes. Eye involvement due to thyroid disease, such as exophthalmos, corneal ulcer, or diplopia, is rated separately under the appropriate eye diagnostic codes. For example, diplopia. Diagnostic code 6090, visual acuity impairment. Diagnostic code 60, 61 to 60, 66. Diagnostic code 7919. C-cell hyperplasia of the thyroid. C-cell hyperplasia, a condition marked by an abnormal increase in thyroid C-cells, may require antineoplastic therapy if it develops into a malignant neoplasm. If antineoplastic therapy is needed, it is rated as a malignant neoplasm under diagnostic code 7914. If a prophylactic thyroidectomy is performed due to genetic testing and no therapy is needed, it is evaluated as hypothyroidism under diagnostic code 7903. These ratings ensure that veterans receive appropriate support during initial diagnosis, active treatment, and any long-term management of residual symptoms. Thank you for watching this video. Please don't forget to subscribe and like our videos.